Hi, I'm Gretchen Tegethoff, CIO at the George Washington University Hospital. While I am new to the CHIME board, I am by no means new to advocacy, serving as the vice chair of the advocacy leadership team, the ALT, for the past 2 years. Certainly the changes during this time have been dramatic. With the passage of the HITECH Act in 2009, the ALT, with expert guidance from the Policy Steering Committee, has publicly responded to every major rule underlying meaningful use as defined by the EHR Medicare and Medicaid Incentive Program. We have held webinars on issues such as understanding the incentive program, final rules and EHR certification, met with ONC on certification and health information exchange, worked with CMS to brief members on registration for the incentive program, held monthly ALT calls focused on ICD-10 5010, the meaningful use timeline, program FAQs, and other issues, and responded to the report of the President's Council on Science and Technology, Designing a Digital Future. Through weekly Advocacy Corner briefs, members are kept informed of the changing health IT landscape, particularly as affected by the changes on Capitol Hill last November and the implications for the incentive program and its stimulus funding. My own institution, the George Washington University Hospital here in the District of Columbia, was the setting for a major public event in January that celebrated the kickoff of Registration Day for the EHR Incentive Program. While we gathered locally, well over 100 hospitals in 45 states also celebrated this kickoff, with many holding media events, issuing press releases, and submitting op-eds to their local newspapers. With a keynote by National Coordinator for Health IT, Dr. David Blumenthal, participation of CIOs from Maryland and Virginia, and representation from the District of Columbia Health Information Exchange and the Regional Extension Center, this local effort echoed our colleagues nationwide, clearly demonstrating that change is taking place. CHIME was pleased to collaborate with HIMSS and our cooperating partners, the American College of Physicians, Association of Clinicians for the Underserved, American Osteopathic Association, and the National Rural Health Association in holding this event. Through EHRs, CHIME members across the country are demonstrating our commitment to our patients. Complementing ALT's work at the national level, StateNet has focused on the important changes taking place at the state level to support meaningful use. We partnered with ONC on a joint letter to the Regional Extension Center directors, co-signed by NHIT Coordinator Dr. David Blumenthal and CHIME President and CEO Rich Carell. Further underscoring our relationship with the RECs, we developed REC principles, and to articulate the important issues underlying health information exchange, StateNet developed HIE principles with recommendations on patient identification, governance, and state cooperation and alignment, which were shared with ONC. The year ahead promises even more change. We are learning together, sharing our questions and solutions as new rules and program details unfold. You are invited to join us on this incredible journey towards meaningful use and better patient care.